Hey guys, it's Patrick. It's after work. It's about 4:30 in the evening, so I'm getting out kind of on time today. I did 4 visits, and they all went pretty good. I met a new patient today. It's always a good time, and somebody who can't hear at all, so I'm like writing things down for him. And throughout the whole visit, I was writing down all of these notes to show him, and fortunately his vision worked okay. Not thinking the whole time that I had a laptop right in front of me and I could have just typed everything out in big letters and saved myself the wrist strain. But surprisingly, this guy was able to read my handwriting. My handwriting is not so good. People who've seen my handwriting can tell you I write like a 4-year-old serial killer. But this guy was able to read it okay, and he was able to talk just fine. And it was kind of fun to communicate that way by passing him notes. I'm going to bring down a whiteboard, like a marker board next time. But now that I'm thinking about it, I got that laptop. I might as well just use that to type out notes. And I get to take around a new hire tomorrow. That's a lot of fun. To drive around a new employee. Maybe this time I'll do a special guest star episode of After Work where I can have somebody else talk on camera. Haven't gotten to do that yet. That's on my to-do list. I think that could be fun. The only other person that I've had on the show is Abigail, my little sister, and now she has friends drive her home from school, so I don't get that particular co-star. So when I get home, I'm going to open up this manila envelope right here, this thing that's got the responses of the audience members to my core course presentation on pain and symptom management. Most of them were nurses from Bacchus, and some of them were EMS folks from American Ambulance. Which I didn't know that there was going to be EMS folks there. They told me it was just going to be nurses. So I would have generalized some parts of it, if there were EMTs there. And the one major disagreement I got on pain and symptom management actually came from somebody from the ambulance company, and I didn't even really understand what his objection was, because I don't know, it's kind of hard to explain. But I was talking about a case study. I think it was a particular lawsuit in California in 1999 called Bergman versus Chen. And I used it as a case study in this presentation about a man who was transported to the hospital with intractable back pain, had 10 out of 10 pain, 7 to 10 out of 10 pain the whole time that he was there, mostly 10 out of 10 pain. And when they were checking him out and evaluating his back pain, they found out that he had advanced lung cancer. On the day of discharge, he had 10 out of 10 pain, went home still in 10 out of 10 pain, and died 4 days later. And the state of California, when they investigated this, found that those people were guilty of elder abuse because they discharged him from the hospital without getting his pain under control. And so the objection that was raised from somebody from the ambulance company was, well, what were they supposed to do? Keep giving him more drugs? And as any of the nurses in the room could have told him, yes, the answer was to keep giving him more drugs if he was still in pain, And, that was part of my content on the opiate narcotics, that unlike non-steroidal anti-inflammatory drugs like aspirin or ibuprofen or things like that, opiates have no ceiling. There's no dosage ceiling on opiates. If somebody is still in pain, they can have more. Totally safely, without any side effects besides constipation, hopefully, if they're used to it. And, I tried to answer his question, in the middle of the presentation, and at the end, my mentor pointed out that, she didn't think that I had adequately answered his question. Because the way that he had phrased it, I thought he was talking about, he mentioned what I had mentioned about differences in culture and difficulties in recognizing pain and things like that. So I launched into an explanation of the Pain AD scale, where you can grade and evaluate pain if somebody's not able to communicate with you, It's like a more objective, pain scale. Only if self-report of pain is not possible. But, as I pointed out, in readdressing his question, in the specific case, he was able to self-report his pain. He was able to tell people that this was the worst pain he'd ever felt in his life. And so yeah, they should have given him more drugs. I mean, that might seem controversial if you're not familiar with, the pharmacology of the drugs and the physiology of pain, which was kind of the purpose of my talk. But this guy who had raised this objection had his back turned to me for most of the presentation and was just talking to his coworkers and drawing their attention away from the presentation. So it's unfortunate that they passed up this opportunity to understand a little more about the pathophysiology of pain, why keeping it under control is important for everybody, whether they're dying or not. But the one piece of verbal feedback I got from my mentor was that it was too long. I haven't cracked open the envelope yet to get more specific feedback, but she said it was too long. And a lot of that had to do with the fact that I was getting instructions for what to put in it from multiple different sources. And I think I mentioned this before. One source said that there was too much clinical info. One source said there was not enough clinical info. And then I got the actual handout from Bacchus about what they expected to be on the presentation, which I thought was kind of funny because we were developing this curriculum, So there was an outline handed to us from the hospital of what they expected to be on it. So I got that at the last minute, and I had to add more stuff into it in order to cover all of those topics. And I think mainly the topics that they wanted to see that I didn't put in there was the consequences of untreated pain in each of these different domains, like endocrinological and immunologic, and all of these different changes in the body when pain is not under control, psychological and things like that. And I thought that was a good thing to add in because it allowed me to segue into a couple of different things, like the consequences of abrupt opiate withdrawal and pseudo-addiction and things like that I hadn't really thought to put in the first place. But more and more slides got added in, and the length of the discussion got longer and longer. And so I guess we're going to have a meeting on Monday to kind of get together and figure out, we've got 6 months to figure out how to refine our curriculum. And it was a really rough time to work on it because I kind of put it off for too long to revisit it and change the presentation around. And it was a pretty tough couple of weeks in school when I was looking to do that. There was a lot of projects due and stuff. And many of them were also PowerPoint presentations, so I got my fill of PowerPoint. I really want to go and learn Prezi now. They got that thing Prezi online. It looks like a lot better than PowerPoint. For a lot of different reasons that I won't go into for fear of sounding like an advertisement for Prezi. But it does seem to be worth investigating to make a more dynamic, eye-grabbing presentation. And to address a lot of the problems with your stereotypical PowerPoint presentation, like when you put the information that you're saying up on the screen, people are just going to look at the screen and not pay attention to what you say, which is not a very good way to teach people things or to cause them to remember them afterwards. But most of the feedback that I got verbally from the people who were reading through the feedback questionnaires said that it was really good, and I got a lot of perfect scores on things. So I'll be interested to look at it. I've always had a problem with taking criticism gracefully, but this will be a good exercise in that. I was doing I was doing my homework for the class that I'm in now in my graduate degree program, on a class on research methods, which is it's very, very dry and abstract, maybe even more than the nursing theory and professional roles class. But one of the interesting tidbits I came across in a slideshow, a lecture slideshow, because it's online, so we don't get lectures, we just get the slideshows instead. Interesting tidbit of information that somebody else told me was slightly out of date was that the number of people a year who graduate from programs with the degree that I'm going for, clinical nursing leadership and a master's in science, is only about 500 people a year. Later, one of my Facebook friends and fellow professional nurses told me that number was a little out of date and it's slightly higher now. But even fewer people per year graduate with doctors of nursing practice degrees. And when I saw the number of people who graduated per year with nursing informatics degrees, I mean, that number seemed really small to me. It was a triple-digit number and lower than the other ones that we were talking about. But now that I compare them with the numbers for the other, post-bachelor's nursing degrees, it looks like they're all low. Like they're all triple digits, and that's pretty wild that there's so few people. And it makes me wonder, with so few people with those degrees, maybe it makes me wonder if I'm going to have to move when I get my master's degree, which would be a real kick in the pants because I just signed a purchasing contract to buy a house. I just signed getting ready to sign a mortgage, But whatever happens will be all right. And here's the house right now that I'm going to buy. The house that I live in. So hopefully I'll find some jobs for clinical nurse leaders in a couple of years, or in a year and a half. So here we are. And let's open this thing. Let's see what they said about me. What is this? Okay, these are all for me. Okay. So let's see. We got a lot of 5s. I got a 3 on not a PowerPoint person. That much is true. Yes. Oh, okay, yeah, these are specific to me. So let's see. For knowledge of subject, 4, 5, 5. Okay, yep. Organized presenting, 5. 5, 5, 5, 5. Very good. 5, 5, 5, 5. Very good. This is out of 5, by the way. 5, 5, 5, 5. Was an awesome day. Thanks. That's nice. 5, 5, 5, 5. Very good. 5, 5, 5, 5. 5, 5, 5, 5 again. 5, 5, 5, 4. Got the 4 in teaching methods. Okay. Probably because of the PowerPoint. Yep. 5, 5, 5, 5. 5, 5, 5, 5. 5, 5, 3, 3. Effective in content delivery and teaching methods for 3 for those. Okay. 5, 5, 5, 5. 5, 5, 5, 5. 5 plus 5, 5, 5. Good. 5, 5, 5, 5. 5, 5, 5, 5. 5, 5, 5, 5 with excellent written in. That's good. Yes. Okay. All 5s again. All 5s again. All 5s again. All 5s again. And I think we're back at the beginning. Nope, we're not at the back at the beginning. All 5s again. And back to where we... Nope, 5, 5, 4, 4. For effective in content delivery and teaching methods again. Yeah, okay. Alright, yeah, that's pretty good. Mostly all 5s, and it looks like the actual method of the presentation is what has to be addressed. And I really agree, because PowerPoints are just such a crappy way to do anything, Alright, what's this stuff? The program evaluation? What's the program evaluation? What is this thing? Oh, that's interesting. Okay. So it's like an evaluation of our program, like the value of the volunteer services rendered and how many patients we see, our total number of staff members, things like that. That's actually pretty interesting. And then here is a copy of the handout that we gave to everybody who went to the course. Symptom management, blah, blah, blah. And that's just a copy of my PowerPoint, which kind of sucks. So yeah, I've got 6 months to learn Prezi and put together a more effective presentation. So now that I've got, nobody had even talked to me about the core course in the time between I've done it the first 2 times that I've done it, this time and the last time. So now that I think we're going to be a little more organized with the feedback, and I'm actually going to get to meet with the clinical outreach nurse and my personal nursing hero, somebody I admire really greatly. So I'm looking forward to get a chance to actually meet with her and get organized for how I do this again next time. That'll be good. I was kind of I had a little bit of Schadenfreude today because I found that all the nurses who are using iPads that I gave back, they tried to give me an iPad and I gave it back. All of the nurses who have iPads now don't like them and they want to give them back too, so I feel kind of validated from that. And they're talking about, where they're going to go next with the electronic charting and hope they make a better choice this time. I mean, that whole remote desktop thing was really just a disaster. All the input lag and connection issues and, stuff like that. The cellular, the digital mobile antenna for getting on the cell phone network wasn't really very reliable, which is something that I could have told them before they went out and bought them. And everybody was interested in buying them because you can't return them. Some of the nurses wanted to buy them at a reduced rate in lieu of being able to return them. So I wouldn't really want an iPad, but I might get one cheap and give one to somebody as a present or something, But yeah, that was some pretty good feedback. That was nice. So I guess that's it. Nothing else interesting going on. I'll talk to you again later.